Hello, thank you for joining us for this week's Rise and Thrive with EHE Health, an interactive series where we discuss all things health together. My name is Dinesh, and I am the marketing producer with EHE Health. And today we are joined by licensed clinical social worker, John Berman, to discuss cultivating the landscape of your mind. Thanks, John, for joining us today. Can you tell our audience a little bit about yourself and what you do?
Thanks, Anesh. I appreciate you having me today. Just want to preface, I have just got a puppy named Joey, so it might make an appearance today. I'm just going to try and keep that to a minimum. But I'm a licensed clinical social worker. I got my bachelor's degree in psychology from SUNY New Paltz in New York and my graduate degree in social work from Florida State University. I was a mental health clinician and social worker in various capacities up until I started working with EHE almost exactly a year ago. Here at EHE, I'm a health mentor. I work with patients on the 3 pillars, eat, think, and move. Obviously, my focus is primarily on the think pillar. So working with patients on stress management, kind of motivation, empowerment, and advocating for change in their lives. So it's really nice to be able to work with patients, not just in mental health, but also the body as well. So it's a nice combination, and I appreciate you having me here today.
Thank you for joining us. So this leads me to my first question. So when a patient sees you, what do they expect when they see a licensed clinical social worker? Like, what type of expectations do they have? What type of issues are they trying to fix? And what are their goals of just seeing one?
For sure. Like I would say outside of mentorship, clinical social worker can do a lot of things, such as like they're very similar to being a therapist, a counselor, a psychologist. So a lot of mental health therapy. Social workers in general do a lot of kind of cultivating and kind of creating change with clients, linking them to different services. But sticking with what I do as a health mentor for EHE, what I primarily do here is just assist patients in kind of cultivating change in their lives. So again, that can be in various different factors. If they're trying to figure out a plan to change their diet or trying to get motivated to find an exercise schedule. And yes, like even though my experience is not specific, I'm not a dietitian, I'm not a nutritionist, I'm not an exercise scientist. At the end of the day, the information is out there a lot of the times. We know what we're supposed to do, but we don't do it. So my goal is to help patients cultivating a unique plan. There's no cookie cutter method for health mentorship. There's no cookie cutter method for being a social worker. We're all unique beings. So it's really just finding what clicks for each person, finding each person's strengths to develop a plan that works best for them.
Yeah, that's really interesting. Especially since like right now during the COVID pandemic, a lot of people are having a lot of mental health issues, a negative impact on mental health. Some people are having issues with stress, specifically those that are working from home. It's kind of hard to balance a work-life balance, especially when you're working from home and you're just working where you live, just because you're always on the laptop and you always have access to your coworkers. So what type of advice could you give to people that are struggling to find the perfect balance between work and life? And what could they do?
All right, well, that's a good question. And I think the first thing is that there can't be a perfect balance. Unfortunately, I have trouble with that word perfection because it just doesn't exist. Yes, you can get 100 in an exam, but I think with the life that we're living in this day and age, especially with COVID disrupting everything, nothing's ever going to be perfect. But I think there's a lot of different things that you can do. The first thing I recommend is kind of setting up some boundaries between work and home. So there's a lot of different things that you can do. You can set a schedule of like, okay, I'm only going to work from 8 to 6. Before that time, after that time, that goes for personal care. That's responsibility, taking care of your children, taking care of your dog, doing all those different things, but really sticking to those boundaries. So maybe you put an alarm on your calendar or you turn your notifications off. So I think for boundaries, that's really important. But also if you have a support network, you live with a spouse or partner with your kids, is working with them as well, because it's not just only you, you're in a unit. So working within that system to find the different ways that, okay, maybe your husband or your wife can watch the kids on Tuesdays and Wednesdays, and that gives you time to finish work. So you can spend time with them Thursdays and Fridays when they're doing something else. So it's really working as a team cohesively. But I think to make this work-life balance sit, stick, it's really to focus on your self-care as well. And self-care takes on a lot of different ways. It's physical, emotional, spiritual, and social. So there's so many different things that you can do for self-care. But I think especially when you're working very hard, and like you said, it's a good point. We're tethered to our devices at home. It's so easy to reach out. It's not like how it used to be when it's 9 to 5 at the office, and when you're on the subway going home, nobody's going to be able to really reach you. Now you're always reachable. So I think it's as much as setting the standards with the colleagues and your people you work with, it's setting that standard with yourself of like, I'm not going to answer that email, or I'm not going to take that call. Okay, maybe the work gets pushed to tomorrow, but that allows you to get that healthy rest of sleep. That allows you time to cook dinner instead of having to go get fast food again. So I think self-care is a big part about this. And also it's the activities, the socialization that you get outside of work. You really want to cultivate that life outside of work, whatever that may be. It could be like reading, video games, playing with your puppy. It could be going out to dinner with your friends, or it could just be getting outside. Getting outside, again, that's such an important thing. Whatever you're doing outside, walking, biking, playing sports, it's changing your environment. That's a big thing as well with boundaries. And there's tons of different things you can do, but it's finding what works best for you, I would say, to kind of get that balance.
Yeah, that's really important, just being in control of everything in your life and just making sure you have like the correct balance. As you know, May is Mental Health Awareness Month. So what can we do to understand and be in control of our mind when it comes to stress and other mental health issues that many people face?
Yeah, that's a good question. I think for sure the first thing you have to do, I would say, is to just accept that you can't control everything. We're people that are driven by like wanting to be in control, wanting to know what's going to happen. So there's always that unknown that causes a lot of, I say, anticipatory anxiety. We worry about things that haven't happened yet, whether they're 2 hours away, 2 months away, 2 years away. So it's kind of accepting that unknown, that we don't know what's going to happen. And that kind of comes down to the idea of mindfulness, which is really just being in the present moment. And that could be mindful eating, that could be mindful play, mindful work, just really kind of bringing yourself to awareness. So there's a lot of different grounding techniques that you can do, physical grounding techniques, such as going to the sink, putting your hands under cold water, shocking your system. If you're kind of in one of those thought loops where you're just thinking about, okay, I don't know when I'm supposed to pick up the kids, what am I going to make for dinner? And then I have to call my mom when I get home. Give yourself a chance. Go to the sink, put your hands underwater. It sounds silly, but you're shocking the system. Or utilize your senses. Your senses are really good to bring you back to that present moment. See what you can, look at what you can see, listen to what you can hear, smell things. You might look a little weird in the office doing it, but again, you're just bringing yourself to that moment and just really trying to take care of like yourself and your needs in that moment. So I think those are really important things. And in addition, it's also just kind of being honest with yourself. Sometimes we have difficulty of just facing the facts. Maybe we're just having a really tough day and we're stressed and we're angry. I know as a therapist and a mentor, sometimes it's difficult to be a mentor when maybe I'm not having the best day. And instead of lying to myself and just putting on a facade, I'll tell myself, you know what, John, you're struggling right now. And I think self-talk is very important. Again, you just want to be honest with yourself, be vulnerable, allow yourself to feel those feelings so then you're not consumed by them. So again, this is something that's going to be unique to everyone. It's figuring out what works best for you. So there's going to be times when maybe you just need to take that extra break. Maybe those times you can push through it. So it's just kind of developing a toolbox of the different coping skills, grounding techniques that you can use to just bring yourself to that awareness. And naturally, we're just going to be stressed. It's something you can't prevent stress. You can't prevent anger. You can't prevent sadness. They're going to come. But instead of distancing yourself from those emotions, we want to give ourselves awareness to them and work through them. And that's why the mentoring therapy, I know we're going to get into that later, is such a great resource and recommend that everybody does it.
Yeah, definitely. And when it comes to coping, different people have different coping mechanisms, but my question is like, how do you make sure, like, say if you're coping in a way that's not good for you, like if you're drinking too much alcohol, or you're eating a lot of junk food, or you're doing drugs, or you're having sex, what's like a good way to get out of that coping mechanism and try to improve your life in a more positive way and try to be as healthy as you can while having these negative coping mechanisms?
For sure. Like I think when we start using maladaptive coping skills, like such as drinking or drugs. Like they have they're working in a sense, like they're allowing you to cope, but there's going to be negative unhealthy effects. So I think again it comes back to that point of mindfulness and awareness, is recognize, okay, why am I binge eating right now? Why am I binge drinking right now? Why am I doing these reckless habits? Is it because I want to get high, I want to get drunk and forget about anything? Or it depends like what you're doing it for. Is it just to kind of get an escape? But at the end of the day, we want to like assemble a toolbox that allows us healthy coping skills. And again, that's where self-care comes into play. They're very kind of synonymous, self-care and coping skills. So you want to just develop different things. And when you have these kind of negative coping skills, you want to bring attention to them and really explore the reasons why you're doing them. Because I think a lot of the times when we utilize those negative coping skills, yes, they might feel good in the moment, but I think afterwards we don't feel as good and the problem doesn't go away. If you drink to excess, you eat to excess, that doesn't help your problems go away. They're just pushing them away. And that's the whole aspect of this process of change. You're going to have to face things. It's going to be difficult at first. That's the toughest part of making any change, is the initial part of recognizing the problem and then really kind of investigating it and replacing it, hopefully, with some healthier coping skills. So again, I would say, to kind of get back to the root of that question, it's really bringing an awareness to the negative coping skills and then working internally, going online, seeing a therapist, talking to friends, talking to family, in terms of kind of creating a bevy of different coping skills that you can use in different experiences and different environments. Like I can use different coping skills when I'm working versus different coping skills when, say, I'm taking a test somewhere. So again, you just want to create those different bevy of resources and tools that allows you to take care of yourself.
Yeah, I think that's really important, to try to catch these bad habits before they become into a bigger issue. Um, and this leads me to my next question. Should everyone be seeing a licensed clinical social worker like you? And what are the benefits of seeing one?
Well, I'm definitely biased because I am because this is my
Yeah.
profession. And when I was in grad school, one of the first things they said is that you should see somebody to be in the patient's chair to see what it's like. And again, taking on a lot of people's different emotions, and the term empath, I've been told, and I feel it is, I experience other people's emotions. I understand what they're going through. To a degree, but I think everybody should. I'll be honest and transparent. I've been seeing people since I was younger, and I just love the idea, even if I'm in a better period in my life than maybe at a time when I was in a worse period of my life. It allows that opportunity for somebody non-biased, because we can talk to our parents, our friends, our siblings, our partners, but they're inherently biased. So finding that person that you connect with. And at the end of the day, my opinion, it doesn't matter what letters they can have. They can have an LMHC, an LMSW, a doctorate in this, a doctorate in that. It's about that genuine connection you have with the patient, with the therapist. That therapeutic relationship is everything. If the therapist genuinely cares about you, then I think you'll feel more open and vulnerable to talk and to get to the root of a lot of these things. I've had good therapists and bad therapists with different levels of experience, different genders and different backgrounds. At the end of the day, the people I work best with is the ones that I feel like really care. And that's how I model my work, is I genuinely care about the patients I work with. I'm only 30 years old. I don't have tons of life experiences. I have different backgrounds than almost all my patients. But that doesn't mean that I don't care about them, that I can't understand what they're going through, even if I haven't gone through them. So yeah, I think seeing a therapist is amazing, even if you're in a really good stage of your life, especially if you're struggling. But I know there's a lot of stigmas around seeing mental health for different cultures. And I think especially for men, sometimes there's a stigma of seeing mental health therapists. But I recommend it to everybody. I think it is a great opportunity to just investigate yourself and just take care of different things that maybe have been dormant for a while, that have just surfaced. So yes, I'm definitely a big proponent.
Well, thank you, John, for sharing your knowledge about maintaining stress, mental health, and having the perfect work-life balance. It was really helpful for you to share all this knowledge to myself and the guests. Thank you for joining us, and please tell the audience where they can find you online. And
Of course. So yeah, what to get enrolled in the mentorship program at EHE, your employer has to have a contract with EHE, part of your benefits package typically. And once you get your preventative exam, which EHE has been doing for over 100 years and is our hallmark, it's our trading card, is you talk to your doctor and they can put in a referral for health mentorship, or you can go on also ehealth.org to sign up for a health mentor. We would love to see you. It's a free resource as well. So if you have this benefit with your company, with EHE Health, there's no reason not to do it. Again, you can focus on nutrition, exercise, mental health, stress management, navigating the workplace, sleep, smoking cessation. So there's tons of different things that you can work with. So highly recommend it to everybody. And thank you, Anesh. Thank you, EHE, for giving me the time to speak about this topic. And truly, I think that we do have the ability to kind of, again, that cultivate like the mind that we want to have despite whatever factors are going on internal, externally. It's not going to be perfect. We can always put ourselves in the best chance to succeed.
Thank you, John. And thank you those at home for watching. Please follow us on Facebook, LinkedIn, and Instagram for additional content. Thank you all for participating and keep up the healthy habits.